A lot of the fear associated with the swine flu in general comes from the 1918-1919 flu pandemic, which happened to be just a catastrophe overall. The flu plague of 1918-19 took 500,000, by the count, American lives and over 30 million lives worldwide. Now, what they don't tell you is most of those deaths were found to be due to bacterial infections and not due to the flu. Okay? Some estimates are upwards of 98% were actually due to bacterial infections, okay? Not due to the flu. But yet we have these kind of skewed numbers up here, 500,000, 30 million lives were taken, and nothing could be further from the truth. As we look here, when you look at the medical care back then, the mortality rate in U.S. military hospitals averaged 36%. So a third of the people were dying. The mortality rate in U.S. medical hospitals was 30-40%, so about the same, okay? Third of those people dying. A rate of 68% was reported in medical hospitals in New York City. So over 2/3 of those people were dying under medical care. One of the reasons is suppressive care. We're working against the body's healing mechanisms. We're staying sick longer. 68% of people are dying. I mean, literally, if you think about that, back then, if you were to go into a hospital, okay, you didn't even have a third of a chance of coming out. You didn't even have a 33% chance of coming out alive, no less. That's amazing. On the other hand, the flip side of the coin, when you look at natural types of care, osteopathic here, 2,445 osteopaths treating 110,122 patients with influenza reported a mortality rate of 0.25%. That's nothing. The 400-bed Massachusetts Osteopathic Clinic Hospital in Boston also reported a mortality rate of 0.25%. I mean, that's a drastic dichotomy there. 68%, 36% to 0.25% when we're looking at natural care. Even chiropractic care. Davenport, Iowa, NDs lost one patient on every 15. Chiropractors at the school, 1,635 cases with one death. Iowa DC's reported 6 deaths out of 4,735 cases. That's a 0.001% mortality rate. That's a thousandth of 1%. Okay? And the point is to say, when you're looking at suppressive care versus natural care, you're looking really at the dichotomy. You're looking at suppressing what the body's trying to do and staying sicker longer and really progressing into more disease, more dysfunction, or you're looking at trying to help the body do what it does. And the body has the ability. So, why the difference? Why the difference, Dr. Krieg?
Thank you, folks. How are we all doing so far? Everyone following along? Everyone learning something? Excellent, excellent. Well, thank you guys for your approach. Well, the difference really mainly being that the treatment consisted of cough syrup to suppress the cough, aspirin to reduce the fever. The very definition of what we just called what? Suppressive health care. Reducing symptoms, and what did Hippocrates say? Symptoms themselves were the cure of disease. They serve a purpose. Osteopathic and chiropractic approaches recognize fever as part of the body's response to an infection and did not choose to reduce the fever. Both DOs, doctors of osteopathy, and DCs, doctors of chiropractic, practice spinal and manipulative care. The success of natural methods. Again, a noted osteopath and medical doctor reported that homeopathic physicians in Philadelphia, for example, reported a mortality rate of 1% for the more than 26,000 flu patients they treated. I'll take my chances on that 1%, okay, as opposed to losing 68%, as we said in New York hospitals. Pretty amazing stuff. Natural methods do not suppress fever or other symptoms, but promote the patient's natural healing abilities. It's really a matter of asking the question, who knows more about your body? The guy with maybe 2 or maybe 4 initials after his or her name, or the God-given wisdom that you were born with, that you were instilled with from the moment of conception that will be with you to the moment that you die. Death by aspirin. There is one drug which directly or indirectly was the cause of the loss of more lives than was influenza itself. Aspirin. The cause of more lives lost than from the flu pandemic of 1918-1919 was aspirin. Amazing stuff. Aspirin was taken until prostration. Now, I've got to be honest with you, I didn't really quite remember what prostration was from chiropractic in school. Total exhaustion. In other words, aspirin was given to the patient, administered to the patient so much that the body just would exhaust itself and collapse. Well, guess what? Not a very good way to fight bacterial and viral infection, resulting in the patient developing pneumonia. Amazing stuff. Suppress the body, the theme over and over again. Attacked by an outside invader. Kill, fight, destroy that bug. Nothing as far as improving the health from the inside out. Julian Wilson, again, noted historian, noted medical researcher. Most of the deaths were caused by a virulent pneumonia that was especially devastating to those who depressed their systems with analgesics, again, pain medication, the most common of which being aspirin. Amazing stuff. It's over again. We keep seeing this.